Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The Preclinical Orthodontics course at the University of Michigan is presented in the sophomore year and is designed to prepare the student dentist for the clinical phase of undergraduate orthodontics in the junior and senior years. The learning objectives of this preclinical course are, first, to introduce orthodontics as a field of study in dentistry; second, to train students in the technical construction of interceptive orthodontic appliances and diagnostic aids; third, to present the students with an opportunity to observe dentofacial growth and development in primary and mixed dentition children; and fourth, to train students in the use of some orthodontic diagnostic techniques, the facial form analysis and the mixed dentition analysis. A variety of technical teaching aids are used in our efforts to accomplish these learning objectives for every student. Videotape demonstrations are extensively used. Slide tape sequences are also involved. A detailed written manual of instruction is provided. Lectures and live technical demonstrations by instructors are also given. Models of completed technical work are on display for student reference and inspection. All of these teaching aids are designed to provide a maximum number of learning opportunities for the students. To begin with, the students receive an introduction to orthodontics through a series of 6 lectures given by an instructor in person to the entire sophomore class. Briefly, here are a few of the slides used to illustrate the subject matter presented. Orthodontic nomenclature and terminology, the nature of malocclusion, classification and description of malocclusion, development of occlusion, craniofacial growth and development, the etiology of malocclusion, and lastly, the role of the family dentist in orthodontics. All of these introductory lectures are presented live to the students by an instructor. However, these lectures all have been prepared as slide tape sequences, and all are available for viewing by the students at any time in the Student Learning Center, which is the individualized media library at the University of Michigan School of Dentistry. The center contains a complete collection of videotapes, slide tape sequences, and other instructional materials for student self-instruction and review. The Learning Center is open for student use from 8 a.m. to 11 p.m. every day and can accommodate up to 70 students at one time. The preclinical orthodontic students are able to review virtually all of the lectures and technical demonstrations for the course whenever they choose. We believe that student learning can be made more effective by the complete availability of all of the instructional materials for the course. The technical portion of the preclinical orthodontics course is presented in a detailed technical manual that is given to each student at the start of the course. This technical manual is illustrated and explained by videotape presentations, actual models of completed technical work, and live lectures and technical demonstrations by teaching staff members. The technical manual contains complete and detailed descriptions with illustrations of alginate impression technique, orthodontic study model preparation, as well as construction of various types of removable and fixed orthodontic appliances. An introductory wire bending exercise is constructed, and then maxillary and mandibular removable Hawley appliances are fabricated. The maxillary technique appliance includes a finger spring for posterior space regaining, along with an anterior bite plane. The mandibular appliance has an inclined plane for correction of functional anterior crossbites, as well as a posterior bite block space maintainer. Fixed appliance construction includes a lingual wire space maintainer regainer and a Porter wire W-shaped expansion appliance for treatment of functional posterior crossbites. A face bow is fitted to 2 molar bands on a model as a bilateral maxillary posterior space regaining appliance. Lastly, the Oral Shield removable habit control appliance is constructed. Videotape presentations provide most of the demonstrations of technical procedures described in the student manual. These demonstration videotapes are shown once to the class as a group and are also available for review by these students at any time in the Learning Center. Here are some excerpts from those demonstration videotapes.
To take the impression, you stand in front of the patient. You slowly rotate the tray into the mouth. With your free hand, you get a hold of the lower lip.
The heels should be trimmed in from 3/8 to 5/8 of an inch. To check your symmetry, again, use your angle former.
Now this wire has been adapted to fit right between the marginal ridges of these two teeth. You mark the wire and begin to sweep the wire down into the palatal portion of the work model with a series of small bends, sliding.
Be sure that the powder is completely wetted. You add powder and liquid over the entire extension, the entire lingual aspect of the lower dental arch, the lower model, as the first step. This diagram of a cross-section of the inclined plane portion of the appliance makes it easier to see how.
You hold the two pieces of wire in the relationship that you want and move them into the soldering flame. You should heat the larger wire. Solder flows from the smaller wire onto the larger wire if the larger wire is heated. Solder flows to heat. You can see the solder flowing. When the solder has flowed the way you want it to be, you remove the two wires from the flame and the solder joint has been formed. Heat is applied to the wire while it's on the work model. You apply heat by moving the flame fairly rapidly around the wire until the wire just begins to turn color. It's a very slight reddish color. For the thumb or finger sucking habit, the Oral Shield may serve as a reminder appliance because it provides a physical barrier to the placement of the thumb or finger into the mouth. Here is an Oral Shield that has been completely adapted to the work model. The edges of the plexiglass are rounded with gemstones and acrylic.
To augment the videotape instructions, a staff of orthodontists is available in the laboratory to provide explanations and technical demonstrations for individual students or small groups. Models of excellent technical work are on display for student viewing in the laboratory at all times. Our objective is to provide a maximum number of learning opportunities for the students. The clinical phase of preclinical orthodontics is designed to allow students to observe dental and facial growth and development in growing children, and to teach students the use of certain diagnostic techniques, the facial form analysis and the mixed dentition analysis. To reach these objectives, each student is assigned a child who is 5 to 10 years of age for the taking of alginate impressions, panorex, cephalograms, and photographs. The students also perform the facial form analysis and mixed dentition analysis on their patients. The diagnostic information the student collects is presented and discussed at a later seminar with the patient present. Comparisons with the child's previous year's radiographs are made to study dentofacial growth and development. The entire seminar group of 6 to 8 students receives the benefit of the learning that each individual student obtained. I hope this presentation has given you a few insights into the teaching methods used in the Preclinical Orthodontics course here at the University of Michigan. Audio-visual aids and illustrated written materials have played a large role in the development of this course into its present form. There are many areas of videotape usage that we have not explored as yet, such as videotape criteria testing for technical work, a collection of diagnostic case study tapes for student diagnosis of clinical problems, and mini tapes, 2 to 3 minutes long, for quick student reference to review technical procedures. All of these possibilities provide for exciting teaching opportunities in undergraduate orthodontics in the future.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.